That test did suck. When I passed first time.
Yeah.
Did you pass hazmat?
Wait for that for the EO.
You got it this year on the EO test. Nothing will stop you this time.
Feel you. All right, that's my name. My name's Corbin Burris. I'm gonna be teaching first aid provider today. So if you guys wanna go over your names real quick so we can kinda have an idea who you are, we're gonna start with this guy up here.
Josh Buckner.
Yeah. So you fireman here?
I am.
Yeah. Joel Champ,
Yeah.
equipment operator, station 13.
Shut up, kid.
Hey, shit.
Good.
Noah Pratt, firefighter at Engine 5A.
Oh, yeah. All right.
Been on
Cool.
firefighter for 5 years.
No previous experience. Hobbies?
What do you need? I know, I don't like it. It's stressing me out.
It's not objection. Are
Yeah,
you
of course.
are you actually recording right now?
Yep, sure. All right, so we're gonna start with this. I know this is gonna be stuff that you guys are pretty familiar with, but bear with me. So, describe the role of the fire service in providing emergency medical care. So, I mean, being on the fire department, it's gonna be any number of things that you guys, we end up having to do. So it's not any one thing. So yeah, if you were on an ambulance, like it would be a little bit more cut and dry. So where you show up and then you're working on packaging the patient to transport them. But in our case, a lot of times, it's just the stuff that we do and waiting for them to get there. So it can be any number of things, to hanging out until the EMS gets there, to actually treating a wound or anything. So like I said, treat on screen and then transport victims. So again, that's gonna be more of a ambulance kind of a setting to where we don't transport here. But treating on scene could be any number of things. It could be, if it's trauma, all the way to just a medical assessment of somebody who doesn't feel well, so. So, like I said, fire-based EMS, and then hospital-based EMS, and then third service EMS. I would equate third service EMS to being like your outlier, not attached to a hospital, kind of a private industry kind of deal for an ambulance. And then most of what we've got around here is gonna be hospital-based EMS, and then like with us, it's just what we're doing just before. We're closer to first responders than we are probably EMTs a lot of the times. Become familiar with equipment, protocols, standards of care. I would equate that to know where your stuff's at. You know, so like we tell rookies all the time when they start, like look over the truck, make sure you know where everything's at. You don't want to be searching for stuff when you need it in the moment. So it's important to train regularly. So like just like the stuff we don't touch a lot. So traction splint is exactly what I was thinking. So traction splint's something we don't use a lot. So, and it sits in that box and doesn't get taken out a whole lot, and then sometimes all the stuff might not be in there, or you go to put it on that guy with a split femur, and you're trying to remember how to put it together. So it's important to train with your stuff, that way you don't lose those skills on stuff that you do all the time. We all know how to administer oxygen, which we're gonna do later. But, because we do it a lot, but we don't do stuff like traction splints and stuff like that a lot, so. Yeah, I mean, there isn't really a big degree of differences between everybody on our department. So everybody's an EMT. There are a few guys that are paramedics on their own time, and those guys are definitely a resource on some different calls. You run some nasty kid calls or anything like that, and it's handy having that paramedic who happens to know a little bit more. But for the most part, we're all about at the same level, so. So around here, what are the roles does the fire department play in providing medical care? Joel?
EMT.
EMT?
That's what we do.
That's what you do. That's basic, nice. What role does the fire department play? Okay, anything, I mean, what are some of the other things that we might do before EMS gets there?
Administer oxygen.
Yeah,
Medical or trauma assessments.
yeah,
Take vital signs.
yeah. And a lot of times they're just doing that. Granted, they don't pay attention to it when you get to them. They just kind of look at you, go, and then they move on. But anyway, it's nice. And honestly, that harks back to it's easy to get complacent. It's easy to just get a pout, or it's easier just to not pull the vital signs on a patient that seems fine because you know EMS is going to get there, probably not care. But the more often you don't do that stuff, the more you even being an EO, like, I mean, I feel that way. Like, there's a lot of things that I don't touch now that I used to all the time. And you do lose a little of that. It gets kind of fuzzy. You're like, oh, it's been a while since I've turned that on. So that harks back to knowing your equipment and messing with it all the time, because it does lose you the less you do it. So I mean, we've kind of touched on this already, but around here we're pretty much first responders. We get there first. So, and we hang out. We usually do baseline vitals. Now, I mean, if it's if it's a trauma, then we're going to be mitigating, and then at the same time, if it's a code or somebody's needing CPR, like then we step in and perform. That's when it feels like we do the most, is when we actually have to intervene. But a lot of times we're just kind of there to get the scene started before EMS actually gets there. This is definitely something that it gets to be a gray area, and not gray area as in like it's not alright. It's just we all talk about calls and stuff like that. We usually do a pretty good job of keeping stuff in the inside the firehouse. Maybe not tightest, but it's definitely something we all try to keep it very vague. So like no names, no addresses, none of that stuff. I mean, it keeps to be a very basic story because you've got to kind of skirt that line of you don't want to infringe on anybody's confidentiality. I haven't turned this thing off. Whoa, that's a mouthful, isn't it? So, yeah, I mean, we're gonna have laws and guidelines and stuff that the city has or that we have when it comes that we need to follow. So we've gotta meet all these HIPAA requirements and whatnot, so like we don't step on anybody's toes when it comes to giving away too much of their sensitive information. And a lot of our reports and everything else are all stored, secured on something that just not anybody has access to. Heck, I can't even do my timesheet without being on the right computer, let alone any of that. So, like we said before, you're being discreet. So I mean, you might want to talk about some of the stuff you see on scene, and it's one thing to talk about it with your other firemen that be there, but you definitely have to be discreet on how much of that you release or just talk about in a regular manner. So who has the right to access patients' medical information?
Hospitals.
Right, so it's going to be their designated care facility that they're going to. Who else might have it?
Individuals that are directly involved with the patient.
Yeah, that sounds happy.
Police.
Yeah,
Right.
they can. I think they have to follow a channel in order to do that, for sure. And then obviously the patient has the right to their own information. So, but I mean, not just anybody can just call up to the firehouse and be like, hey, I need to see the report on any of that. Like, it's just not something we ever have to deal with, nor would we give that information over the phone. I don't even know if it's sunshineable, actually. I really don't think so.
A lot of that is.
I don't think it is. I mean, with the city, you kind of feel that way, that everything is under scrutiny, but realistically. So, communicable diseases. I mean, we at the BSI Scene Safe drilled into us all the time, but especially with COVID, you can't cough in a room anymore without feeling like somebody's coughing on you. So it's definitely something that we have to take in mind. What are some of the diseases that we kind of typically worry about? Not just diseases, I would just say like contaminants in general.
Like the flu.
I say any fluids I see on a patient, that is definitely like make sure my gloves are a little higher up.
Yeah, or just good habits as far as not kneeling down, especially, I mean, it's one thing in bunker pants, but it's another with your actual pants, like.
Yeah.
Wearing masks and
Yeah.
make sure you have all that full
Yes,
PPE.
yeah. Yeah, sometimes a mask, sometimes your own breath is a lot better than the room air that's gonna be in there, for
100%.
sure. Yeah, yeah, for sure. Well, when I first started doing the EMS stuff, they were always worried about TB. Like we got TB tested, I don't know if you remember that, Champ, where they'd stick that needle underneath and lift and shit. Yeah, like they were all paranoid about it. Yeah, you would do that all in annually, and I don't hear any about it anymore. I don't know if TB's necessarily went away, but it doesn't seem to be something that they are concerned themselves with. I guess COVID's probably more in the worst of any of that. I wouldn't want TB. Another thing in the mask thing is probably a pretty good thing. We probably should get better habit of that. Every once in a while we'll see some notes and stuff on the call that are like, possible TB kind of situations that could be in the air. So a mask wouldn't hurt droplet wise. But yeah, they don't seem to worry about it as much as they used to. Yeah, so I mean, just like with TB. So I mean, patients may have diseases that they're going to give you, and they may communicate those diseases to you, and they may not. So if you don't protect yourself going into the situation, and you're waiting for somebody to be responsible, you might not get it. They may tell you that they've got TB, or they may have, Hep C, like we had the other night. So like, that definitely can happen, where they communicate some of those things that they have, but they're not. Or like real bad car wrecks where there's glass and blood everywhere, and then the guy's like, I have HIV. You're like, oh, I have all my stuff on, but do I have enough? You know? So it's definitely to know that going into it. So I mean, you just like identifying signs and symptoms of common communicable diseases, like you show up to a car wreck and there's glass all over the ground and blood going around. I mean, yeah, they might be all right, but they might not be. So it's best to try to maybe wear some gloves on the outside of your other gloves or that kind of stuff to keep that extra level of BSI when it comes to that. And just being up on your immunizations. So I think that's something we don't necessarily do as good as we probably should. They seem to care a bunch when we first get on. And they're like, you gotta have all these shots, and they're throwing shots at you like you're a dartboard. But realistically, like, there's not a whole lot of follow-up on that. I think it's almost on you to have to follow up on them. I don't know the last time I've had some of those boosters, really.
Tetanus is the only one they really worry about, I feel like.
Didn't we have to have, there's a vaccine for one of the hepatitis, isn't there?
Yeah,
But
I can't remember now.
I can't either.
Yeah.
But I mean, it's something to be definitely up on. You don't think about it until you have to go get drug tested, or somebody spit in your mouth, or any of that kind of stuff, and then you're dealing with that. So, well, hepatitis, just like we ran on a gal the other day that had an inflammation of the liver, so, and she was kind of all over the place, but you're going to run into it a lot. Not that some of the hepatitis are more communicative than the others. I think as long as you don't get some of them in you, I think you're all right, but still, you got to try not to do that. So if she had been spewing and vomiting everywhere or whatnot, it would have been a whole other ball game than it was that we had. So, yeah, and I think, and just in her case, I think she'd been drinking, so it definitely didn't help the situation. So, yeah. Keep your fluids to yourself and keep their fluids to themselves. Some of the symptoms and whatnot of the different types of hepatitis. I think there's one of them that is, hepatitis A, you're going to get more from contaminated food and whatnot. I think they've got a vaccine for, I think hepatitis C now actually is a fairly new thing, I think. I think if you already got it.
A and B, but C was in the works, but
I think they have one now. I think it's more of a, I think if you've already got hep C, I think you're toast. But if you're a newly acquired hep C individual or previous before you have it, I think you can get it, but I don't know that for sure. So, yeah, I wouldn't want hepatitis D and B. It sounds rough. So, well, there we go. If I'd have known it was coming, I wouldn't have sounded like it. So, yeah, I think they've gotten closer on the hep C, I think. So, yeah, see, we need to be immunized against hepatitis. Like, I think they get you on those, but they don't last forever. So, be something to look into. And definitely wash your hands. I can't, man. Sometimes that box of hand sanitizer, tube of hand sanitizer in the fire truck isn't enough, for sure. And then what is it? I'm using that antibacterial, like, gnarly soap now. That stuff's what's up. It's, you definitely feel pretty clean. So, and bacterial infection and everything else. So, it'd be the same kind of deal. Like, just keeping all that just gross stuff off of you. How many times you want to take a bath or you work a code and you're like, I can't be clean enough coming back to get that stuff off of you. So, and your boots, something we don't pay attention enough to enough, is clean those off because you're walking in all these people's homes. And then you come back and you walk in our firehouse and then you're dragging it all over everywhere in the fire truck. The fire trucks don't get, the floors don't get clean enough. I know that, at least ours probably doesn't. So, definitely something to be conscientious of. Bed bugs. I would roll that right into any of these other things to be safe, but I don't want to bring any of that jazz back. Like
clothes.
Yeah, bunker gear you get soiled with. Yeah. Oof. So obviously, like, yes, with TB, like that's going to be your signs and symptoms, but honestly, those signs and symptoms are pretty indicative of just your body not feeling well. So, I mean, you getting any of those. I don't know if there's a laser on this thing or not.
It doesn't work on the
Oh,
screen.
of course it doesn't. And the battery's about dead too. Neat. Good luck, champ. So, like, man, if you show up with any of those, whether you're at work or not, you need to be starting thinking like, well, my body doesn't feel great, especially with COVID anymore. We all are super sensitive to any of those kinds of feeling. So TB doesn't sound fun. I don't think there's a cure for TB, so I think you just got it. Thomas does have like a vaccine or something for it, doesn't he? Or is it
Well,
something
that's
else?
Heidi, yeah.
Or is it just a different form of?
I don't think, yeah, he had he had COVID before COVID was COVID.
Right, but he,
I don't
but
think
he
he
had
had
some other
TB.
vaccine, I thought, maybe it wasn't TV, it's something weird.
Yeah, they might do something different
Yeah.
in South Korea, I'll have to ask.
Right. And again, it goes hand in hand with COVID or anything else. So, precautious in testing. So, I mean, just especially with COVID anymore, the strain's getting so, I don't want to say mild, it's different with everybody, but that it'll sneak up on you. I mean, I had it when we had that hazmat class. And I didn't feel great, but I didn't feel bad. And then I went ahead and tested because we were going somewhere over to a friend's house and tests are easy. Burnt one and I was like, well, shit. I'm like, well, my evening just went. So, and N95, like we were talking about earlier, like, there's a lot of calls that I wear it just cause anymore. If they've got anything to where it sounds like they're coughing or fluish or any of that, I'd rather smell my own breath than their house sometimes, so. And then you can make faces underneath the mask, they can't see 'em. So, but, yeah, HIV can take a long time before you really show any signs of symptoms having it. So like we were talking about earlier with the glass in the rack or whatever, that there might be blood everywhere. You may be exposed to it unless you like mentally notate that or actually fill that exposure report out. It might be long enough after that you've come in contact with HIV that you may have it, but not realize that for a long time. You might not even remember when it happened. So it's best to do those exposure reports and everything else. That way you can look back and go, it was that one. I mean, I still remember the call that I first got COVID, so you don't forget it. So, yeah, just like any of that other, with TB or anything else, if your body's sick, it's gonna act pretty similar. It's not gonna, something's off, definitely see something, say something, kind of a deal. So, and I'm just like with anything else. So, I mean, if your body's fighting one thing, if it gets another ailment, it's gonna have a harder time fighting that off, just because it's dealing with other things at the moment. So that's why it's definitely just best to have good BSI procedures and decontaminate everything. That way you might not have got it on the call, but you got that box of med stuff dirty, and then you went and used it 2 other calls later, and then you got whatever was from 3 calls before on you, and then just a domino effect. So harks back to just decontaminate those boxes in the fire truck and everything else that gets, soiled and whatnot. Yeah, you wouldn't want any of that. Yeah, been there. Yeah. Yeah, because you may end up coming in contact with something that's rough to kill. I mean, I had something that I had to deal with for 6-8 months that I finally got rid of. That's why I use that fancy soap. So, like, it's rough. It's definitely